Let's release the shackles and take some praise from Mary Mary. Dance. Sunshine and rain. God has broken every chain. Mary, Mary. And you're welcome to Ultimate Health with me, Nortey by Nature. That's how we kick off this and every Sunday. We do it for the cause and not for the applause. Wow, I spent a couple of weeks with the Chief Capo at the Medical and Dental Council. Divine Benyubala, Dr. Divine Benyubala. And we do a lot of medicine, don't we, right? So I thought today we'd take a break and go into dentistry. So I've got the oral gatekeepers here. Dr. Albert Hammond, Senior Dental Officer, Lead Dental Consultant at Nabita Hospital. Dr. Patrick Banneman Agbeshi. Some say Agbeshi. I think it's Agbeshi. Yeah, he's also a dental consultant with the Sam J Specialist Hospital here in Accra. We're going to be looking at one of the most common conditions. Yes, tooth decay, dental cavities or caries. My reading suggests that, hey, 100% over, not over, but up to 100%. If you're talking about prevalence, adults will have dental cavities and tooth decay at some point in time. We're looking at understanding what causes it. I understand it's related to diet and many other things. So you're welcome aboard. And doctors, you're welcome.
Thank you. Well, good afternoon, Nortey.
Albert and Patrick. Yeah, we've been doing a lot of stuff with your chief regulator, the Medical and Dental Council. But some people sometimes accuse us of neglecting some of the other areas. Though Albert will, give testimony that we do a lot of dental stuff as well.
That is right.
But it's great to have you in the studio. I'm pushing. Patrick, you're welcome. I haven't had you in the studio before.
Well, the last time I had you, you were my lecturer back in school, so it's good to see you again.
That wasn't a studio. Great to see you guys. Both of you. Stop telling stories about me. Right? But tooth decay. Now, one of the things that strikes me is that it seems unavoidable, though we know it is preventable. Right? Looking at the figures we see, it's one of the most common conditions, not just if you look at conditions generally. Am I right in saying that, well, if you eat and you take in food, some amount of decay will take place? Am I right in saying that, even though we're going to look at, how to manage it or prevent it.
Okay. So good afternoon to all our listeners. Say that there are certain things that have to come together for tooth decay to occur.
Okay.
Yes, and some of those things are an ever constant in our lives. So, for example, the mere fact that you have teeth,
right,
is itself creates the chance for decay to occur, because decay occurs on the teeth. So once you have teeth, potentially you could have decay.
Agreed.
And you mentioned the diet. Yes, there are certain kinds of foods that we eat that make it very likely for decay to occur. So if you should continue eating a lot of those things, chances are that you also develop decay. And then we have bacteria in our mouth. Okay. You cannot eliminate all the bacteria in the mouth.
Some of them are supposed to be there.
They are supposed to be there.
Okay.
But there are a certain group of bacteria that cause decay. So if you eat food that promotes decay and those bacteria are in the mouth, you have given them enough food to feast on, and then the decay process starts. But this will take place over a long period of time. Yes. These things must be present for decay to take place. Okay,
folks, you must have teeth for them to decay, right? Of course, if you are creating the conducive gated premise for these bacteria we'll be learning about, then of course you accelerate the process and you make yourself more vulnerable to the things we're going to be talking about. Okay, but I wanted to play that kind of advocate and say, Charlie, can you stop it at all? These guys in the studio, the dentists in the studio, will be telling us how we can limit it and prevent the serious damage that can occur, the serious health damage that can occur. So having said that, Patrick, let me bring you in on this point. Okay, tooth decay. Sounds like it speaks for itself, but what exactly are we talking about? What is it?
Okay, so in times past, we've always kind of described it as a disease.
Right.
It's an infection.
Right.
Bacteria challenging the surface of the teeth because they have available food on a tooth that hasn't been cleaned properly over time.
Right.
But then I like to look at it as a point where it's more of a how do I put it? It's more like a habit. It's something we can avoid.
All right.
Typically because dental caries in itself is not cast in stone. Just because you have teeth or there is food and the bacteria are there, something will happen.
Okay.
Time is always the fourth factor that Dr. Hammond also mentioned comes in and plays a very big difference.
Okay.
With time, we're talking about frequency. Are you brushing your teeth? Are you brushing it twice a day?
Okay.
Even if twice a day, are you doing it for the minimum 3 to 4 minutes? Are you doing it very well? Is this consistent every day of the 365-day period? Because mind you, if the bacteria are having a buffet every night over a period, they would have more than enough to produce the byproducts which would tend to affect the surface of the tooth and then cause it to be damaged.
Okay.
So the time factor actually overrides many of the other factors that he's mentioned prior.
So if I suggest that, then we're talking about a progressive breakdown of the tooth.
Yes.
Right? That's what we mean when we say tooth decay.
Yes.
All right? And the bacteria and the conditions we're mentioning are the factors that, or the mechanisms of that decay.
Yes.
Right?
Yes.
So over time, there's a breakdown of your teeth.
Yes.
Right? Or tooth material. Right? And we're going to be talking about what causes this.
Yes.
And the main culprits.
That's right.
Right? And you're suggesting to me that there's a behavioral or lifestyle aspect of this, which really is habit. What you do would determine whether you are more vulnerable to cavities, caries, and so on and so forth. Okay.
Exactly so.
Most of you would be interested to know that the word caries itself is Latin, and it means decay. Right? Okay, so invariably we're talking about the same thing. I know I'll get the discerning listeners asking, what's the difference between a cavity and a carie, right? And so on and so forth. But my guests are in the studio to answer that. So, Dr. Hammond, I see you have some form of illustrative, should I say?
A chart.
Chart.
Yes.
To explain what we're talking about.
To explain what happens, yes.
Okay.
So most of what we see when anyone opens the mouth is the white part of the tooth.
Okay.
Okay. What we call the enamel.
Right.
And
the outer surface.
The outer surface.
Okay.
Okay. And the enamel happens to be the hardest substance in the whole body.
Right.
Yes. It's what protects the crown of the tooth, what we see on the outside.
Okay.
Yes. So
You see, God doesn't make mistakes.
No, not at all.
Right.
The
Not at
ultimate
all.
design.
It's
Yes.
coated.
Yes,
With
it's
the hardest.
the
substance.
hardest
Yes.
Wow.
in the
Than
whole
bone.
body.
Okay.
Great. So, looking at the tooth surface, you will see that when you look at the biting surface of any tooth, especially the back teeth,
Right.
there are some grooves, natural grooves that
Right.
run through.
Okay.
These grooves serve as good points to trap very sticky food, especially the refined carbohydrates.
Okay.
So your chocolates, your toffees, in fact, anything that has some fermentable carbohydrate in it.
Can we just angle that so that
Yes. Yes.
so that our camera can capture
Okay.
it properly, right?
Yes.
All right. So yeah, that should be okay.
Okay.
Yeah.
Yes.
Go ahead.
So anything that has fermentable carbohydrates in it, this lodges within those grooves on the biting surface,
Okay.
and then our bacteria friends
Mm-hmm.
eat that substrate or the food,
Right.
and they produce bacteria. So, like I said, it's not all the bacteria. There are
Okay.
certain particular bacteria
All right.
that would work on the food and produce the acid. Now, enamel is very, very strong, but it can also be broken down by the acid.
Okay.
Yes. Now, there's a certain balance in the body. The rate at which the enamel will be broken down by the acid that is produced, and then the balance between the body's own ability to reverse that process.
Okay.
So when the balance tilts towards the other side, which is the acid side, then the decay process continues.
Right.
So typically, decay will start from the enamel and then travel through the next layer of the tooth, which is also very hard, but not as hard as the enamel, which is the
The
dentin.
dentine. Right.
And when it gets to dentin, the spread is very, very, very fast.
Okay.
Okay. And by the time you realize, then it goes to the next layer of the tooth, which is the pulp.
Right.
That is where the nerves and blood vessels, lymphatics of the tooth are.
Okay.
Depending on the part of the tooth that the decay has gotten to, that is what will influence what kind of signs and symptoms an individual will experience, and will also influence what kind of treatment is offered.
All right. Great stuff. If you just joined us, it's 19 minutes already past the hour of 2 on Joy 99.7 FM. I'm in the studio with Doctors Patrick Bannerman Agbesi of the Samjay Specialist Hospital and Dr. Albert Hammond of the Nabita Hospital in Tema. They are both dentists. We're talking about tooth decay and dental cavities. If you have any questions, concerns, WhatsApp is 055 11 11 997. We're live on Facebook, and the buttons to push if you want to call us is 0302 221 6541. Ultimate Health on Joy 99.7 FM. Make no mistake, it's Joy. Right. So I understand this. And you said something which is critical, that the body, or in this sense, the oral cavity, the mouth, has a certain chemical balance.
Yes.
Right? And if it tilts towards acidity, then this degradation and damage of the teeth will be accelerated.
Yes, that's right.
Okay. Now, what regulates? You said it has its own way of regulating. I know there's saliva.
There's saliva.
Right. So this acidity, alkalinity, and stuff like that. And then again, you're also telling my listeners that there are foods we take.
Yes.
Right? The breakdown of which, if they remain in the oral cavity for a long time because we don't clean well, leads to more acidity.
Yes.
Right. Can we get clarity on that? So how is the mouth able to regulate and balance its own acidity by itself or normally? And then how does it deviate from this?
Okay.
Right. I don't know which of you will take.
So let me go, and then Patrick will come in.
go.
So saliva itself is alkaline.
Oh, okay.
Yes. And the acids or the whatever the bacteria we work on is acidic.
Okay.
So when you have an alkaline medium and an acidic medium, we put them together, then it becomes neutral.
Okay.
So that's the role of saliva. We have realized that in individuals whose saliva production is compromised, either because of one systemic disease, or maybe they've had surgery, and the glands are removed, or they've had radiotherapy, or any other condition that affects the rate of salivary flow, higher incidences of tooth decay have been found in such individuals if they do not take the necessary steps. Okay. Aside from the buffering action of the saliva itself, saliva also has a good store of fluoride. Okay. The fluoride that we take in our diet and then the fluoride that maybe in our water. Some water is fluoridated. Okay. Some milk is also fluoridated. Okay. So the fluoride that is in the saliva plays a very important role in reversing the decay process that has started, and also makes the surface of the tooth more resistant to the
saliva is critical.
So saliva is very important, very critical.
All right.
Yes. People tend to fast a lot when they think they have too much. It's awful. But saliva has a lot of good stuff that protects the body against decay and other diseases as well.
Good. Okay. Right. So the saliva is in there to balance.
Yes.
Okay. And we are taking in stuff which, should I say, makes us more vulnerable. Dr. Banamanagbeshi, somebody is saying here that you're a relative. Let me read a couple of these and come back. Nortey Dua, when I see my full name, Mr. Alfred Nortey Dua, then I know it's Douglas from DC. I have never visited the dentist before, and in a year, how many times do you have to visit the dentist, right? Does the Pepsodent we use, we were talking about this, all toothpaste is Pepsodent, also have something to do with the teeth, either to have nice and strong teeth? That's from Douglas. Hang on to that, or should I say my guest should chew on that whilst I read a couple more. This one says, Nortey, that's my family dentist, Dr. Agbeshi, Patrick Agbeshi, in your studios. Very astute and dedicated to exceptional customer dental care. Extend our regards from Elikem Lakeside Estates. That was a mouthful, Elikem, but since it's oral. Right, so giving you the thumbs up there. Good afternoon, Nortey. Please, what causes swelling of the gum? Henrietta Mante Audome Estate will not let us digest tooth decay, and she's gone to swelling of the gum. I hope maybe we can say a word on that later. Yes, but let's focus, Henrietta. Since you are my mom's namesake, we will answer that. Right, so let's come back to this process. What are we eating? Right, we must eat. We must nourish the body, and the food we take goes through the mouth. Okay, we chew it, we do all sorts of stuff, then we swallow it. So what is it? What's our crime there when it comes to tooth decay? What could we be doing wrong?
It's just the behavior.
All right.
It's the behavior, our attitude towards hygiene.
Okay.
Which many people don't take very, very seriously. Surprisingly. It will surprise you, but...
Especially and particularly oral hygiene.
No, hygiene in general, but dental in our space, in our side of interest.
Right, okay.
Meaning that the average adult does not brush their teeth 2 times a day. Fact.
Okay.
Why
are you looking at me like that?
I'll find another camera.
Am I the average adult?
well.
Come on, cut me some slack.
I did. So typically, people don't brush their teeth twice a day. And even if they do, they're spending about 45 seconds because they are rushing to go to work. They are rushing to wake the kids up and get them ready for school. So even how they do it, there's a bit of a challenge there.
So that's already a problem.
Yeah, so it's all the behavior of how we keep things going.
Okay.
Or then they tend to use a very hard toothbrush. That's another problem. And then they would jump on using a lot of mouthwash to kind of cover up for I don't brush my teeth twice a day, or in the evening I just throw in my branded mouthwash. We don't want to mention names here.
I detect in there some kind of message which tells us that the mouthwash doesn't cut.
It's an adjunct. It helps.
It helps.
It helps, but it is not.
It does not replace.
I cannot tell you to stop taking your bath and use deodorant 24/7. It will not help you.
Okay.
But if you do take your bath and you add the deodorant or a perfume, you complement what that has done.
Folks, so the behavior the you here is not me, okay? It's all of us, though Patrick is pointing at me. Okay.
So the behavior is typically how we brush our teeth, and then the diet choices. Back when I was growing up, I'm not too old here, but if you had Fanta or Coke, it was 3 times a year. It was your birthday, it was Easter and Christmas. Right now, the kids are taking...
That had nothing to do with your age. It was pocket matter. But we understand. So dietary changes.
Dietary changes. The kids are being thrown all manner of sweet stuff. I mean, the parents, upper middle, come to elite, they can afford it, so why not? Okay. Or let them have a whole Coke, let them have a whole, and then they don't really emphasize on the brushing because they're out chasing money. And by the time they come back, the nanny has put child A and B and C to sleep.
Right.
When they wake up and they're on their way out, child A, B, and C are still asleep. They only see them on the weekends, and they probably drop them off with grandma. Ever so loving grandma, let the kids have anything they want.
Okay.
And then the balance of... So that just goes on on, and then the time thing comes in.
Right.
The behavior is locked in time.
Let me just pick on this one you just said.
Fact.
You know, you mentioned adults. The average adult doesn't brush their teeth twice, and so on and so forth. And then the actual brushing, the choice of brush, overuse or reliance on mouthwashes, and so on and so forth. You mentioned all that. It seemed to be in the adult zone. Then you switch to kids. Are we saying or suggesting, or is it the case that these bad practices or habits are laid down very early, and therefore, as a dentist, you're telling us that what you teach your children about dental and oral hygiene and the practices and processes is what they carry into adulthood?
And that is spot on.
Okay.
I want to just talk a little about the diet and the time of the day. So let's take it for granted that everybody brushes twice a day. You brush at 9, then you remember, oh, I have some snack in the fridge, some ice cream, some chocolate. I can't wait till tomorrow. Somebody will cross me and eat it. So you brushed your teeth fine at 9 p.m., but then you go for that snack, that sticky carbohydrate. Okay. Now, you're not going back to brush again because in your mind, you brush twice a day.
Maybe.
Now, at night time,
right,
salivary flow is very, very low compared to during the daytime. Right. And so when you put in that food, which is good fodder for the bacteria,
right,
and you are typically sleeping 6 hours, 7 hours, 8 hours for some people, that is holiday for the bacteria.
Wow.
You are asleep, but a lot of acid has been produced. Your salivary flow is low. There's no buffering activity. So you can imagine a child who snacks from a very early age. Or let's go even younger, babies. Right. Okay, your child is crying. You want the child to sleep. So you get a feeding bottle laced with very sugary food.
So that they'll
sleep. Now
bribery has started.
That is buffing the surface of the teeth. And typically, the teeth of children are less resistant to decay than adults.
Right.
So that is how it goes.
Okay,
gradually. And by the time you are old, you've built a certain habit, which is very difficult to correct.
All right. Great. 29 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05. We are live by His grace, and we pursue all the issues that impact on your health and well-being. Today we're looking at tooth decay and dental cavities with Dr. Patrick Bannerman Agbeshi of the Sam J Specialist Hospital and Dr. Albert Hammond of the Nabita Hospital. Both are dentists. Now, I'm hoping by now, halfway through the program, you're ready with your confessions and you know what the deal is when it comes to the factors and the processes and the behaviors and habits that predispose us to alarming rates of tooth decay and the problems that ensue, right? So that's what we're talking about with the two doctors. If you have any questions, concerns, experiences, confessions, testimonies, 055 11 11 997, that's the WhatsApp, and 0302 216 541. Those are the healthy buttons to push. We are also live on Facebook and YouTube, so if you're on those platforms and many of the others, you probably would have seen the graphic representation that Dr. Hammond put up earlier, but we will put those on our online pages as well so you can benefit. Right. So we understand these things. These things are going on. We're talking about certain things that these bacteria love. All right. I like describing the oral cavity as a gated premise. Right. And you put all these plush things in there for them to chew on. Right. What are the topmost culprits when it comes to food and food products that enhance or promote the activity of these bacteria? I hear a lot about sugar, right? Is it just sugar or sugar products? What else is, should I say, nice for these bacteria?
Anything is nice for the bacteria.
Right.
Anything that would go into the mouth and can sit there for a while.
Okay.
Is good enough to be chomped off by the bacteria.
Right.
Just as that the more refined ones are easier to break down.
So
by them.
Refined carbohydrates.
Refined carbohydrates. All the carbonated drinks, all the
call some of the common names. People will say refined carbohydrate.
Okay, so typically your fizzy drinks.
Right.
Okay. Fizzy drinks, aside from the sugar that is in the fizzy drink, they are also highly acidic.
Right.
And they can also wear the teeth away.
Right.
So that makes the enamel prone to decay.
Okay.
And then we have some other medical conditions. People who have reflux disease. So typically you are bringing the contents of your stomach out. Okay, that is very acidic material that is supposed to stay in the stomach.
Okay.
So you have any medical condition at all in which you are vomiting a lot, or those who have these eating disorders, purging, trying to force the food out. Okay. That acid there breaks down the tooth and makes it very susceptible to decay.
Okay.
And then there's one other thing about the teeth also, which is the arrangement of the teeth. Okay, so if you have teeth that are very crowded, they are difficult to clean. So the more crowded your teeth are, I mean,
what does that mean, Doc? I mean, is it that there should be spaces between my teeth? Is it that I have the 32 that I should have, but they are in a restricted space? Should my mouth be bigger? What are you saying?
there are people who have 32 teeth.
Right.
But they have very large teeth and a small mouth.
Okay.
So the teeth will not arrange well. Okay. And then there are some people who have normal teeth, but the teeth did not sprout at the correct places that are supposed to come out. Okay, so then they will be crowded.
Right.
So when it's crowding, the normal curvature that you are supposed to have, or the normal arrangement for the teeth to follow, for you to be able to clean very, very well, it becomes a bit more difficult. So you eat and then you notice that food is sticking in between your teeth.
Right.
Anytime you eat, you always have to get some toothpick, get the meat out. It's just an indication that once food can hide at that corner, you can have bacteria also doing their thing at that side. And by the time you realize, you are waking up at night with some excruciating pain.
Right. Okay. This is from Decay in Maryland. Decay, thanks for joining us. What effect does tooth or teeth whitening have on the enamel? Should the teeth be pearly white? This is something I always ask because I read somewhere that when the tooth decay progresses to a certain point, you will see a white spot, right? Which suggests to me that, well, the tooth is not exactly white.
Yeah.
Huh? What about gum chewing? Does it have any impact on what we're talking about? Should teeth be brushed and flossed after every meal? That is also a mouthful.
Okay.
Right? So she's asking, does tooth or teeth whitening have any effect on the enamel?
Yes. If you whiten your teeth, that's peroxide.
Right.
Okay. And if anyone has whitened their teeth, one of the things they can tell you is that their teeth become very sensitive. After. So
even if you guys do it.
Yes.
Right.
So we have ways that we can reduce the sensitivity for the patient. And unfortunately, there are a lot of people who do this whitening by themselves without any professional touch, or there are people who masquerade as professionals and do it in the wrong way.
All right.
Okay,
so you're compromising the enamel already.
Yes, you are. Okay, you are. There's something she said about flossing, and flossing is important because no matter how good your toothbrushing technique is, you cannot clean in between your teeth. Okay, so what the floss does, apart from the floss, we have interdental brushes. These are micro toothbrushes that you can slide in between your teeth, and then they sweep out whatever food that is trapped. Okay, the contact points for the teeth are a very common place for decay to occur, because our toothbrushes cannot get there. Many of us don't floss to get the food out, and so once the bacteria detect that there's food there, they'll also start the decay process from that side, and by the time you realize there's a cavity forming in between your teeth.
Folks, 36 minutes past the hour of 2, and we haven't even gotten to the cavity, the hole, the caca, or the painful toothache yet. But you see, it is serious business, and we have to lay the foundation. That's the hallmark of ultimate health. We must lay the foundation. We haven't even gotten to the hole yet, too, or caca, or whatever you call it, and the tooth aches and all that. We're just going through the process, and you start to understand that, Chale, there's a lot going on in my mouth. You might even, as I speak now, be rethinking or revisiting kissing. Another thing. Kissing is an acidic sport.
We will not go there.
It's an acidic sport.
We will not go there.
Okay. The dentist say I should leave kissing alone, right? So I have professional advice. You can join us 0302216541 and share with us. We're talking about tooth decay and dental cavities. We're hearing that more often than not, we are the culprits. Of course, there are disease conditions and other things that may predispose you, but more often than not, what we do or don't do is the issue. Right. This one says, good afternoon, Nortey. Please ask for me, is toothache hereditary? Can you inherit a toothache or the tendency to get toothaches? What can one also do to remove colors and decay already occurred? Ajiman Joseph wants to know. Right. I knew as soon as I bring the dentist, we're in big business. Right. This one says, hello, Nortey. I have this bad breath, which I understand can be from either my stomach or my head. I actually have had tooth decay, but it was treated and filled. But notice people's breath are cut short, or you feel uncomfortable when you are around them. I hope to get a suggestion. Don't know if it is halitosis or something else. All right. So he's talking about bad breath. He's had some bother with tooth decay, sorted out. Okay. But he still believes or reports that he has bad breath and it's affecting how he feels around people.
Okay, I'll strongly suggest he visits the nearest dentist for a full examination.
Full examination and evaluation.
The hereditary part. So you can't inherit a toothache, but there are certain conditions which are transmissible in families.
Okay.
For example, if there are defects in the formation of the teeth, there are certain defects that affect the formation of the enamel and dentine.
Okay.
There are people who have defects in saliva production. Certain autoimmune conditions. Certain things are you get it from your parents.
Right.
Okay, so those ones being there, yes, it is possible for you to be predisposed to disease.
Okay.
And then the habits, so in the family, mother teaches children, we brush this way. These children grow up, they teach their children, we brush this way.
Okay.
We eat this way. So you see a family with a certain pattern of brushing and dietary practices.
Okay.
And they all say, all of us, when we get to a certain age, we get this decay. It's not really because it's hereditary, but they have certain habits that have been learned and passed on through all the generations.
Great stuff. Okay, this is from Edel Geetha. I salute Nortey by nature and the team. Keep up the good work. Nice shirt, Nortey. Oh, thank you. Hey, Okro Eyes. Okro Eyes. Well, that's why we are on all the platforms, Facebook, YouTube. This is Joy 99.7 FM. It's almost 40 minutes past the hour 2. We're doing justice to, or digesting, tooth decay and dental cavities with my dentist in the studio, Dr. Patrick Bannerman Agbesi of the Samjay Specialist Hospital. Where's the Samjay Hospital? Hacho, that's right. Right. And Dr. Albert Hammond is with the Nabita Hospital in Tema Community 4. Right. Okay, great stuff. Hi, Nortey. Lately, I've been experiencing sensitive teeth. What should I do? Does Sensodyne actually work? I am in my mid-40s. Thanks. This is AC. Okay. Right. Another topic we had laid for later, but tooth sensitivity, right, and decay, are they related in any way? Can they be related?
Well, you could have sensitivity secondary to decay.
All right.
And then there's sensitivity that is not from decay.
So related.
We would suggest to him to visit the dentist. And then
this is the hair. This is AC. Right. But she also asked a question specifically about a product.
Okay.
Sensodyne, right? I'll leave the product out, but there are several products that say they address or they help manage, in some words, even treat tooth sensitivity. And she's asking of this particular product, right? But I want us to take the general question.
Product,
Do they work?
Yes. So you see, when you look at tooth from with a microscope, you will see that there are tiny pores or holes that run through the tooth. Okay. So what those products do is that they block the surfaces of those pores.
Right.
Okay, so that the things that trigger the sensitivity, be it cold water, warm tea, chocolate, cannot get into the pores, stimulate the nerves, and give you the sensitivity. So these products work. But however, if the sensitivity is because there's decay and you use those products,
any of those products,
you will not get the proper relief because there's an underlying cause. You have to treat that cause.
All right.
And then most of the time the sensitivity goes away.
Okay, my phone lines are still active, 0302-216-541. Right, we're talking about tooth decay, dental cavities with the dentist in the studio on Joy 99.7 FM. The program is Ultimate Health. Now, let me just quickly ask this question.
Could I jump in onto
the
the
Yeah.
sensitivity? So typically what people would do with the products that are purported to solve these sensitivity issues is that there's a contact time that the product should be on the surface of the tooth, which they often so neglect. So this is somebody who would brush with a tub of toothpaste, 5 seconds, spit it out, rinse it out, and you expect it to work. It's like stepping out of the bathroom, putting on your perfume or your deodorant, and then the one that trickles on your skin, you take your towel and wipe it off and still expect to go out smelling like $1 million. It doesn't happen.
All right.
So traditionally we'd ask you that take just a pea size of that toothpaste, topically apply it over the surface of the tooth we're looking at.
Apply the toothpaste on your teeth with your finger?
Yes, with your finger.
Right.
Your clean finger, of course. And then sleep with it at night. So with what Dr. Hammond mentioned earlier about during the nighttime, the saliva production is reduced. You have more than enough contact time for these tubules to be blocked, for the active ingredients or active agents in these purported products to take effect. But if you just brush with it under 5 seconds or under 25 seconds,
never heard this before.
Once a day, yes. So if you realize these products, the tubes, they're not like family size. It's just something small. But you're like, oh, I use it within 1 week, it's finished. You're like, hey, how come? I had to buy 5, 6, and they're pricey. So challenge is you just take a pea size, place it over the surface of the teeth, and then sleep.
And not even for our everyday toothbrushing. The fact is, if you brush and you rinse out immediately, work done is zero.
Just spit out.
Because the active ingredients in the paste also need time.
It needs time.
Yeah, so what I advise people is that you brush your teeth, spit out the excess. What is left on the surface of the tooth, okay, you can go and do your chores. I mean, iron your clothes, sweep your yard. Okay, when you are done with all those things, but that's enough time for the active ingredient in whatever paste that you have used to have worked. And then you can come and rinse out.
Wow. Okay, Dede in Maryland says, the tools used to remove plaque, do they gradually erode the enamel? Why do teeth crack and break away? What causes misalignment? Dede. All right, that's about 7 programs. So Dede, stay tuned till like December, right? We'll sort you out. Right?
Yes.
There are different, in radio and in education, you break things into modules so that our listeners can benefit. There are great points. I don't know whether you want to comment on them quickly. Then we'll package them. We'll get to talk about those ones.
What we use to scale the teeth, that's the scaler. It doesn't damage the enamel at all.
Especially if it's handled by a professional.
Professionals, and because it's ultrasonic, it's not force that you use to scale. It's the ultrasonic nature that just vibrates the dirt away. That's what is supposed to happen. What causes teeth to crack? Habits. It's possible. I mean, you open beer bottle, instead of an opener. And as I mentioned, disorders that affect the formation of the teeth. So the teeth don't form too well. They are not strong. They can crack under pressure.
Okay. All right. Good afternoon, Nortey. Please ask the dentist. My 10-month-old son drools excessively. Should I be worried? This is from Sally. He drools saliva. She's not talking about milk. Right. Again, taking us into other areas. But a quick response for her. 10 months.
10 months. What I'll just say is that let's visit the health facility. There are lots of causes of drooling. So we need to rule out all of them. But there's the normal drooling goes away as a child learns to motor function.
So what you're saying is it's appropriate at a certain developmental stage.
Yes, but at a certain
Therefore,
age,
you call it normal drooling.
Yes, but
right.
At
it's
a
not
certain,
a worry or a bother.
No. But at a certain age, there's an underlying cause that needs to be looked at.
Okay. Douglas in DC said his question has not. He
yes.
hadn't been to the dentist before.
Douglas.
And then he says that the Pepsodent we use have something to do with the teeth. Either to have nice, so he's basically, do toothpaste do anything?
They do. They help.
Yeah,
they help out. But Douglas, the idea is that we should see a dentist twice a year. It's not fashion. It's not because somebody wants to cash out on you just opening your mouth. Thing is that a lot of the dental conditions that continue gets worse.
All right.
If you have a cavity that looks like a millimeter deep, trust me, in 2 months, it will be a whole lot deeper.
Right.
Thing also is that treatments, people say it's expensive. If you nip it in the bud early, you save cost.
Right.
So the concept of seeing a dentist twice a year helps to quickly identify where problem areas could kickstart, explain why these could also start. Let's say somebody started a law program and they're doing a weekend crash program. So at night between 11 and 4, they are drinking Coke and biscuits to keep awake and study. So all of a sudden, that's frequency of too much refined sugar in the person's mouth. And of course, this person's a average 32-year-old, very highly educated person, but they'll come to the clinic with a cavity. And you're like, oh, how come you have a cavity? You should understand that the person is in school. They are reading at certain times of day. So these behavior things happen and tend to switch that balance we discussed earlier. So he should see a dentist just for a check. You just have to, I want to see what's going on. And then if any problems are identified, they are quickly nipped in the bud.
Douglas, please do that. Since you add DC to your name, Douglas in DC. DC is for dental cavity. Right? So go sort it out, okay? Right. If you have any questions, concerns, 030-221-6541, right? Call us and ask the dentist. I'll try and keep them here up to 3 o'clock, but maybe next week we'll go into some of the details. Now, let me ask this question. So we've explained what is happening with regard to tooth decay. Will I feel anything? What shows the process is ongoing? Should I go and see a dentist? Of course, you suggested and recommended twice a year. Will the dentist see anything that shows that, hey, there's a process ongoing, right? And at what point will I start getting these symptoms that people report? I think I have a call online. Let me quickly take that and then come back. Hello, good afternoon.
Hi, good afternoon. My name is Nam, calling from Tantra Hill.
Now from
Yes, from Tantra.
Okay, go ahead.
I want to find out, does ice have any effect on the teeth?
Ice?
Yes, ice cubes. If somebody is addicted to ice cubes.
Now, if you want to confess properly.
Yes, it's true. I am an addict to ice.
Okay.
I can't do anything without it. I go everywhere with it. I take it. Sleeping, waking up, everything is ice. So I want to find out, does she have any effect on the teeth?
Now your confession is properly before God. So she's an ice addict, right? There's another caller. She's an ice addict. She's now from Tantra. We'll hang on to that. Another caller. Hello, good afternoon.
Afternoon, boss. I hope you're doing well.
Hey, Ajiman Joseph.
Yes, I was.
Confess.
Yeah, quick one. I know we brush our teeth morning and evening because evening we consume something and we need to get them out of our mouth and our teeth so that we go to sleep. But in the afternoon too, we might be chewing some certain things, and sometimes in the afternoon, weekends like this, we feel asleep. Do you also concern about it, washing our mouth before we go to bed for some few minutes, or for the afternoon, it doesn't matter?
Okay. So this morning and evening, so afternoon, we are free or we are not required to, is what Ajiman Joseph is asking. Hang on to that. Another caller. Hello.
Yeah.
Hi.
Hi, okay.
Yeah, who am I speaking to?
My name is Lorraine. I'm calling from Ringway.
Lorraine from Ringway.
Yes, please.
Okay, Lorraine, go ahead.
The problem is I have some cavity, and I've had it for about 2 years.
Okay.
They're okay. But the problem is the somebody asked for how you get the sensitive teeth, how you deal with it.
Okay, so you're cool with the cavity, but...
Yeah, I'm cool with it. No, I'm not cool with it, but I manage it.
You manage, confess. Yes. I like confessions.
Yes,
let's go.
I confess.
How do you manage your cavities?
Because I won't too hard to go into it.
Okay, you avoid it.
You avoid it.
You see, I know you. So you chew on a particular side or in particular places?
There's all the sides, but I'm very careful. I have, I got into a routine that I chew in a certain manner.
Okay.
But,
all right. So you want to know how to manage the sensitivity that arises.
Exactly.
Okie dokie. All right.
Exactly.
Great. So we've got, So 9 Tantra, addicted to ice blocks.
Ice blocks. So That is not good.
Right.
You know, extremes of temperature. Okay, so you take something cold, next time something hot. You are expanding, contracting your teeth.
Okay.
It's only about time that they will break, and even the fact that you are chewing on the ice. Okay, that is not the function of the teeth. They are going to start chipping off. Little by little, and then once you get to dentine, you are in trouble.
Okay.
Sensitivity takes over.
You won't say now should come and see me.
Very much so.
And yes, so the eating disorders we talked
Yeah,
about.
yeah.
Yes, there are a group of eating disorders. People eat or chew things that have no nutritional value, and yes, they definitely have to see a psychologist.
She's a confessed addict.
Once we leave it to you.
Right.
Yes.
Adman Joseph wanted to know cleaning of the teeth
in the afternoon. The good thing about eating in the afternoon, so it's not like at night. We said that the salivary flow is less at night. Okay. Plus the fact that you are even chewing. Okay, the teeth have a way of cleaning themselves. Once you move your muscles, saliva is being stimulated. So there's not so much of a problem during the daytime. However, when you notice that you've eaten, food is stuck in between your teeth. That one you don't have to wait till evening before you clear it out. You use your dental floss or interdental brush, clear it out, and then make sure that you see a dentist to ascertain why the food is packing in between your teeth. So
or you can just simply rinse with water.
Rinse with water. The last caller who talked about having a cavity and sensitivity at the same time and has a way of managing it. You see, cavities don't heal by themselves.
Yeah.
You see, so that takes us back to the signs and symptoms. When the cavity starts, it starts from enamel. There is no pain. There is no sensitivity.
Right.
You wouldn't know unless you visit the dentist, who by means of probing, or using an X-ray or any of the fiber optic methods that we have, lightning, advanced lightning, is able to detect that, there's a cavity that has started over there. And even that one, when the cavity is detected, depending on how the extent is, then we know how to treat. When the decay gets to dentine, that's where the problem starts. So sensitivity to hot and cold. You take the hot and cold away, it goes away.
Right.
So the patients feel fine. They learn to adapt.
Right.
But the decay process continues.
Right.
So from enamel, no symptoms, signs. Dentine, sensitivity, which responds when the stimulus is taken away. Then it gets to pulp. Now, when it gets to the pulp, at that time,
full-blown pain.
A little stimuli, the sensitivity of the pain you have is high. Yes, but again, you're still able to chew.
Outer is enamel. Next level
is dentine,
and
then the pulp.
Core is pulp.
The core is the pulp.
Yes.
So you're saying that the tooth has been,
the crown,
right,
has been sublayered.
Right. So compromised to the point that it has reached the core.
The core.
The pulp.
Yes.
Right.
And even when it gets to the pulp, it can now spread
within
out of the tooth into the bone. Okay, and that bone, there's not supposed to be any form of bacteria over there.
Wow.
So once the bacteria gets there, then you have other things going on.
Right.
So you notice that your face is swollen. And this can spread. Because depending on whether it's the upper jaw, lower jaw, it's going to spread into the jaw, the bone. Can spread into the soft tissues, the face. It can eat even the all the muscles over here, spread into your chest region.
Kill you.
That is all from tooth
decay can kill.
Yes. So it's not something to be played with
at all.
Lightly.
Okie dokie. Right. So don't play with it. Not even lightly. Don't play. Right. But let me get to understand this. So our essential task is to prevent it.
Prevent. Yes.
Right. And if we identify it, is to arrest it.
Yes.
Okay. And therefore, there will be different levels of treatment and management.
That is right.
Okay.
That is
right. So, folks, I'm saying all this as a wrap-up, pulling things together, because we'll have to go into a second phase or second dose of this. So, we've understood the process. We've understood some of our behavioral habits, right, or practices that predispose us. Okay. And people are, in a way, confessing things they do.
They've been doing,
you know, somebody says, I'm managing. I chew on one side, but if I have to chew on this side, I know how I do it, but there's still sensitivity. Okay? So we've talked about sensitivity as well.
Yes.
So that gives us an idea that the sooner, the earlier, a friend of mine used to say, Tileria Tibata. the earlier, the better, right? So if you are visiting your dentist on a regular basis, there's a good chance that these things will be picked up.
That is
right.
Excellent.
And then any intervention required can be started in earnest,
Yes.
and then you get the benefits.
You'll
and
get the
results.
benefits, yes.
Okay,
Yes.
so that's important.
Yes.
Very, very key.
Okay, this one says, good afternoon, Nortey and your guests. You're looking sharp in your outfits. Does charcoal powder and plantain stick prevent tooth decay? Papa and from Latte, right? He adds an H there. Equapim, right?
Yeah, so that is that works. Okay, but
Charcoal.
yes, charcoal, because when you look at the constituent of regular toothpaste, there's an abrasive in there. Okay, charcoal is an abrasive. Okay, so yes, the abrasive effect, you will get it, but that is not the whole thing, because when you look at a toothpaste, it has lots of other active ingredients that have been squeezed together into one tube. So you need something that has antimicrobial action.
All right.
You get that in the toothpaste.
All right.
Yes. So I will say that now we even advise a blend. So there are people who use their chewing stick or plantain leaves. They add a little bit of toothpaste,
right,
and it's good to go.
Okay. So we've enhanced.
Yes.
Yeah. Right.
So we are not shooting down the tooth.
Okay.
In fact, the charcoal now has come in toothpaste. A lot of people are marketing it, but the fact is that no matter what you use, don't forget in between your teeth.
Right. Can you quickly address, so the charcoal toothpastes that are being widely promoted is not recent, but now
yes,
the formulation
it's more aggressive.
More aggressive.
Is it just charcoal paste, or is it charcoal with all the fluoride and the other things?
All the other things.
Yes. So the correct ones, let me emphasize correct ones, have all the other things added.
Okay.
So if it is only charcoal you are using, then you get only one benefit, which is the abrasive effect of the charcoal.
Okay.
So make sure that whatever you are buying, check the back of the box, check the label. It's very, very important. There are standard doses for fluoride.
Right.
For the age groups.
You can have an overdose.
Yeah, you can have an overdose. Right. I mean, that's why kids don't use adult toothpaste. I mean, you can go to a home and everybody is using the same paste. I mean, Hakuna Matata. But it doesn't work like that.
I thought if it's a small tube, then it's for children.
No, you have to read at the back.
Really?
Yes. Yeah. The doses are there.
Oh boy.
So you know what is for kids and what is for adults. So if it's a charcoal paste, just make sure that it has all those other if in doubt, let your oral health practitioner have a look at it, and they'll be able to advise you.
All right.
Yeah.
Okie dokie. I saw something on my phone about scaling of the teeth. I think it was Araba who sent that.
I think that was Decay.
Yes, no, but I've got another one.
Another one, okay.
Is it why? Do you recommend or advise that?
Scaling is recommended every 6 months.
Okay.
At the minimum. There are some people who may have, somebody talked about gum swelling, which is a sign of gum disease. Okay. So people like that may need to see the dentist for not only scaling, but other periodontal treatments that will enhance the supporting tissues of their teeth.
Great. Okay, great stuff. We're out of time. It's actually 3:00. It's been a mouthful, but we've been busy. We've been having fun and getting done. Somebody's asking about, Dede is asking about chewing soft bones. A big no-no, question mark. Dede,
enjoy your bones.
Right, enjoy your bones.
Enjoy your bones. But don't
see your dentist. Right, and talking of dentists, our good friend Dr. McLean Okan.
Yes.
He's in the US for further studies.
Yes.
But he's listening to us and he's impressed. Hey,
the big man.
Charlie, Dr. McLean, you're the only dentist I know with the first name of a toothpaste. Right? But keep up the good work and do come back. This is the kind of brain drain we do like. Yeah, he's called McLean. Yeah. Washeda. Right. So many thanks, Dr. Patrick Bannerman Agbesi of the Sam J Hospital, Hacho, and Dr. Albert Hammond of the Nabita Hospital in Tema. We'll have them next week because we didn't get into the deal itself and the pain. We're still on the surface of the tooth, which is the enamel, right? And we'll get to the next layers, and then we'll get to consider treatment and management as well next week. Many thanks to my producer, Abeku-san Kofi, and of course to my discerning listeners. Hey, you guys, you do as if you're not listening, and then you start to blast. during the getting to the tail end. Many thanks to you, my listeners. We'll be back next week with another easy to digest and chew edition